My name is Alexandra Elms and my major is Public Health Education. My presentation is on cystic fibrosis, also known as CF. Cystic fibrosis has been a cause of death for thousands of years. However, it wasn't until 1938 that a pathologist performing autopsies on children who had died because of malnutrition began thinking that cystic fibrosis was a disease of the pancreas. Other doctors during this time wanted it to be known that thickened mucus was a problem with this disease. In 1948, it was discovered that CF patients have a higher salt content in their bodies compared to people without the disease. This discovery happened because of a doctor who was observing infants being brought into a New York City emergency room because of dehydration. In 1989, the CF gene was discovered and the genetic code for the disease was also sequenced. Now that the history of CF is known, what exactly is it? According to the Mayo Clinic, cystic fibrosis is an inherited disorder that causes severe damage to the lungs, digestive system, and other organs in the body. CF is known to affect all the exocrine glands in the body, which cause extremely thick secretions, causing obstruction in pathways such as the bronchi. Since the secretions are so thick and are difficult to get out of the body, bacteria can become trapped, causing respiratory infections such as pneumonia. According to the annual data report from the Cystic Fibrosis Foundation, in 2015 there were 28,983 total cases of CF, with 853 being new cases. Of the new cases, 59.6% were diagnosed by newborn screening. More than 75% of CF cases are diagnosed by the age of 2. Currently, over half of CF patients are over the age of 18. Diagnosis for CF can begin early. Pregnant women can have an amniocentesis performed to see if the fetus has cystic fibrosis. Although in the United States, all newborn babies are tested to see if they have the gene for CF and to see if their pancreas is working correctly. If either of these tests come back odd, a sweat test is the next step. The sweat test will determine if the child has an above level of salt in the body. This test is performed twice to ensure accuracy. Other tests may be performed, such as genetic tests, chest x-rays, lung function test, and a sputum culture may be needed to help to check for bacteria. Currently, there is no cure for cystic fibrosis. Patients with CF work with many doctors to help manage their disease and stay in line with the goals of treatment. According to the Mayo Clinic, these goals are preventing lung infections, keeping mucus loose or removing it from the lungs, preventing blockage in the intestines, and getting the right nutrition. CF patients may also take a number of medications, antibiotics for infections, anti-inflammatory drugs if there is any swelling, and bronchodilators to keep airways open. The main public health strategy for CF is newborn screening. This is something that can be done for every newborn to check for serious diseases at birth. There are also several things to do to increase life expectancy, and first and foremost, early diagnosis is key. Also, having nutritional support, draining mucus, getting needed medications as soon as possible, knowing about and participating in excellent hygiene, not just inside a CF center, and knowing when there are problems with CF. When people began realizing what CF was, patients had short and painful lives. As varying and milder types of CF became noticeable, drugs and antibiotics became available to help treat the disease. CF centers also came about so patients could go receive the care they needed and earn a better quality of life in the process. With the medical care we have today, many CF patients stay out of the hospital. However, medical bills can be upwards of $25,000 a year. To conclude this presentation, here is my list of references.